honored to have today. She's kind enough to join us. She's kind enough to give some remarks, and she's kind enough to hear some questions and some remarks when we're done. So without further ado, Senator Renee Unterman of Buford.
Thank you very much. It's an honor to be able to be here, and I'd like to especially thank the Georgia Healthcare Association and Russell. I hope y'all know, y'all may not know this, but he is one of the most dedicated new lobbyists. He worked in government at the state capitol. I feel like he's my son and I've raised him up. But he is one of the sweetest persons you can ever meet, and he just does a great job. And we're very enthusiastic that he went to work for the Healthcare Association because we all know him and we can trust him and we know that he'll do a good job. And I had dinner last night with Pat and Barbara, and we had a great dinner, and I appreciate that. And just being here and being with you. Because the most important thing is I'm one of you. I look at you and I see myself. And the difference is you may be in management, you may be in direct care, you may be in administration. And that's where I was, and now I write the laws and the policy, but I'm on the same level that you are. And I feel like I have the same heart that you do. You know, I was looking at my Twitter account the other day, and it said, you know, follow me on Twitter now. You know everything I'm going to be doing. You can follow me on Twitter. But it said nursing is not just a profession, it's a calling. And that is exactly right. You don't get paid enough. And it's a female-dominated, you know, profession, and that's one of the reasons why you've never gotten paid enough. But what you get is what you get in your heart, and you value in your spirit. And that's kind of what I have taken into politics. I don't get a whole lot out of politics, the power, all that ego stuff, I don't get out of it. But what I do get out of it is still helping people. And I help people on a different level. I started off as nursing school at Georgia State, and I did my practicum at Grady. And, you know, I've never, ever forgotten my roots and where I came from. And my constituents are my most important thing to me. And I was telling Pat last night, when I became mayor of a small city, it was like the dog that caught the bus, you know. I'm like, oh, my God, what do I do? I don't know how to be a mayor. I don't know how to be a public speaker. And, you know, it evolved. And what I did was I took my nursing care plan. And for my city, instead of taking a John Doe, and John Doe had a broken leg, and we were going to repair his leg, and, you know, he had emotional problems, we were going to intervene, and, you know, John Doe was going to end up walking. Well, I transferred that. I had a broken water sewage plant. It was overflowing. The EPD, the EPA was after me. I was going to mitigate that, and then I was going to make sure that every toilet in my city flushed. And that was my nursing care plan. So I took what I learned all those years to be able to run a city. And literally now, when I look at problems, you know, in the back of my mind, I do a nursing care plan. And I was a nurse a long time ago, 40 years ago probably. And I've been in medicine my whole life, but I still think, you know, logically about how to go through a process and how to remedy problems. And it's things that stay with you the rest of your life. First of all, I want to tell you two things. I believe y'all invited Chairman Sharon Cooper, and she is my colleague and the same person in the House. I'm in the Senate. And one thing that's unique, and I wanted to give you a little tidbit that you can take home and be proud of the state of Georgia. In the whole United States, we are the only Health and Human Services Committee in any legislature that has 2 female nurses that are in charge. That's incredible. Yeah. And I have to admit, Sharon is much more educated than I am, and she actually taught nursing. And I went on and got a degree in social work, but we still, you know, have that nursing background, and you should be very proud of that. And we are proud not of ourselves, but of the profession that we represent. The other thing I want to tell you about, and then I'm going to go into some of the issues that are real important to you, is that on January 11th, we're going to have a memorial service. at the Capitol. And that memorial service is for the 5 nursing students that were killed on I-16. And if you don't know that story, it's one of the most tragic stories. You all know what it's like to get up in the morning and have to be at a practicum at 7 a.m. and you have to be there sometimes at 6 or sometimes at 6:30, and you're a young nursing student. Well, these students were going to their very last day of practicum. I think it was from Valdosta to Savannah to go to the hospital and finish up, and they were tragically in an accident, a car accident, and they were all killed. So on the first day of session, I'm having a memorial service on the Capitol steps. I've invited the governor and lieutenant governor. And the most important thing is their memory, but it's also the profession of nursing and workforce development and how crucial they were to the state. And they're emblematic of what nurses are, of giving. And they literally gave their life trying to finish up in their practicum and start their new profession. So we're going to have their families, and I invite you, if you would like to come down, if you're in the Atlanta metro area, to come down. I've got all the nursing deans are going to be there, and their families are coming, and we're going to have a very nice ceremony to honor them. So main thing I'm here. I drove all the way up here just to say thank you, because I know you're dedicated. I know you want to help. I know you want to serve. And we need you. Workforce development in the state is one of the main things we do about nurses. We don't have enough nurses. And when the baby boomer nursing generation retires, we really are going to have a deficit. I'm emblematic of that, and a lot of y'all in this room are. We need to promote nursing, and that's one of the things that Sharon and I both do at the Capitol, is that workforce development, and how are we going to get new nurses? How are we going to keep nurses? So I'm going to go through here and just talk a little bit about what I do. And it was real funny, when I walked in the room, right outside these doors was this. I wrote this. Can you believe that? This is the post law. People ask me, what do you do? My husband's out there. You don't do anything. So I got this. I'm going to say, I did this. I really did do this. This is the post law. And the other thing I picked up was the Georgia Advanced Directive for Healthcare. I wrote that law. And there's many, many laws that I've written. And it's all based on my experience. The Alzheimer's in particular, I've been very involved in Alzheimer's and related dementia. Wrote the state plan. I'm still involved. I go to quarterly meetings on that. But when you look at my resume, you can kind of see my roots and where that nursing career originated from. Because since I've been elected 23 years now. 25 years, excuse me, it's been so long. I've been elected as an elected official in some capacity for 25 years. But if you look at that span and you look at what I've brought to the table, what I think is the most important thing is victimization and taking care of the most vulnerable. And I know that's what a lot of you in this room do. You take care of the elderly, you work in hospice. And that's what I have brought to the table, because those are the types of issues. And I take care of the very young, because they're the most vulnerable. For 8 years now, I've worked on sex trafficking and sex trafficking of minors. Georgia, when I first started out 8 years ago, was #1 in the nation for sex trafficking of minors in the whole nation. People talk about, I want to go to Thailand, I want to go to Haiti, I want to go here. I'm like, go downtown to the Greyhound bus station and let me show you kids getting picked up. I had a little girl 2 weeks ago, ran away from Lawrenceville, Georgia, got picked up on the street a day and a half later by 2 pimps, was held in Stone Mountain for 10 days, used 24/7 for sex. And she ran away to a convenience store. And fortunately, when she ran away, she called back home to Lawrenceville. And a little boy that knew me, he's a man now, called me and said, what can I do? And I said, well, I've worked on this for 8 years. I've developed the safety net. I've put hundreds of thousands, millions of dollars into the safety net. Let's see if it works. I called the caseworker. He picked her up, took her to CHOA, to Children's Healthcare of Atlanta, there at Emory, and she was admitted into CHOA, and she went into the safety net, and she was rescued. So issues like that. So people like you can make a difference, just like I've made a difference with that background in nursing. With the elderly, I've written almost every law about elder abuse that's been in the state of Georgia. And my first slogan was, what dawned on me, I was sitting there in the house. I was in the house then. And this girl got up and started talking about animal abuse. And, animal abuse is terrible. And she was talking about, how people are cruel to animals and we needed a law about it. And a light went off on my head and I said, oh my God, she's talking about animals. What about humans? What about the elderly? I said, why don't people take care of the elderly? Why is it not a felony? And I came up with a slogan. Why is it not okay to kick your dog, but it was okay to kick your grandma? And I wrote the very first law on elder abuse that made it a felony conviction if you did harm an elderly person, whether it was fraud, paper abuse, or whatever, or if it was physical abuse. So that's the kind of things that I have brought back. I think one of the things that Pat asked me to talk about was what is occurring current day in the state. And right now, this summer and fall, I'm working on many study committees. And people think when they watch the news and everything, we go into session in January, it's just a flurry of activity and papers flying and people creating and, whatever came from home, But really where legislation is started and created is in these very thoughtful, methodical study committees that really delve down into an issue. And that is where legislation, that is where money, and that is where policy that is written into the state budget. The state budget is over $20 billion, and I happen to be vice chairman of appropriations and work on budget 365 days a year. But that's where all of this starts. So I'm going to tell you about some of the study committees that I'm working on this year. And also the reason this is so critical to you, because as you know, healthcare is evolving and changing. I've been in it since I was 18 years old. We're in a healthcare crisis, and you are part of that infrastructure change and the crisis that's occurring. And you know it because you know the pressure that's put on you every single day when you go to work. And you see it evolving. And my saying is, if you're not at the table, you're going to get eaten at the table. And that's exactly what's happening with nurses, unfortunately, because they're not at the table. And I'm going to talk about that before I leave. But I have 7 study committees that I'm working on. One of the most important is a women's health study committee. And it started in my mind, and it started when I started touring rural Georgia and seeing the OBGYN crisis and the prenatal problems that we have, and Georgia being one of the top states in the nation for infant mortality and morbidity. So I wrote this study committee, and I've kind of emblazoned, I don't know what's the word. I've made it grow. I'm a typical politician. I made it grow. And we're talking more about than just OBGYN services. We're talking about disease specific to women, whether it's cancer, cardiovascular disease, stroke, ovarian cancer, osteoporosis. So we've kind of raised it out. We've had one meeting in Atlanta. We're going to Augusta. We're going to Tifton, and in Tifton, we're specifically going to talk about OBGYN services in the rural areas and how we're remedying and mitigating the problems with that. So that's a very important problem, important issue. I'm working on children's mental health. I have a mental health committee where I put 2 study committees together. We're talking about ADHD and the overprescribing of medication for children. We're talking about addiction problems. That's a very important committee. What you're going to see out of that committee come is more dollars into behavioral health, and I write that budget for the Department of Behavioral Health, developmental disabilities and addiction diseases. You're going to see more money put into that department, but specifically we found the crevices where children are falling through the cracks on mental health issues. And it's not just their physical issues, but it's the behavioral health issues. So you're going to see us putting more money and more emphasis on behavioral health. One of the most complicated committees we have going is about consumer payments and the consumer and what is happening with providers. And specifically, that's about rental networks. And if you don't know what rental networks are, I challenge you to look it up on the computer and learn more about rental networks because it directly affects you. It's very, very complicated. It involves the insurance world, providers, and consumers, and what we're trying to do to help providers. One committee that I haven't had a hearing on is abusive billing. And this is about in-network and out-of-network. And I'll give you a great example. I had a lobbyist who was going to have twins. And he's very informed. He's involved in health care. So he looked at his insurance. His wife was going to have the twins at Piedmont Hospital. And that was great. And he made sure the OB was in network. The hospital was in network. But unfortunately, those twins were born prematurely. And they had severe complications. They had to be moved from the regular OB floor back to the NICU. And unfortunately, when they went through those double doors, guess what? They were out of network. And the neonatologist was out of network. A lot of the intensive therapies those babies had to have was out of network. Well, he came home and he had hundreds of thousands of dollars of bills. And he didn't even know it. What was he supposed to do? Don't take my twins back there and take care of them? Of course not. They were going to take care of them. But that's what this committee is looking at, is how to remedy that situation. It's also very complicated because it involves the insurance world and providers, and especially the hospitals. And that's very, very complicated. The other one is sexual assault on college campuses. That's been an issue that's been in the media quite a bit. In particular, I'm interested in that and how the universities and colleges are taking care of our kids, and how when something very tragic happens, to make sure that they're taken care of properly. And I don't believe they have been. I think there's a lot of work to do on that. And rape kits are one of the issues that's been on the front page of the Atlanta Journal-Constitution, about rape kits sitting on shelves, thousands of them all over the state of Georgia, and nothing ever being done with them. Nothing. Absolutely nothing. They just do it. They do it in the emergency room, and then they put them on a shelf and they sit there. So we're looking at those types of issues. The other issue is public health nurses. Over my course of career, I have had a particular interest in public health. And we have public health nurses just leaving in droves. And the reason they're leaving public health is because they get attracted to hospitals and higher paying jobs. And some of y'all may have been former public health nurses that went to better jobs. So unfortunately, public health is critical in the state of Georgia. We have 159 counties. We have 157 public health departments. And in my opinion, they do a great job. When you look at immunizations, you look at women's health, you look at the WIC program, these nurses are critical. And one of our goals is to make sure that we're taking care of our public health nurses. We're attracting new ones. A lot of those baby boomer public health nurses are retiring, and who's going to fill the void? And in these rural areas, I went to one county down below Columbus, public health. I said to the nurse at the public health department that I went to see, who are the professionals in the county? She said, I am, and the sheriff is. That was all the professionals in the county other than the teachers. They didn't have a gas station. They didn't have a grocery store. They had to go to another county. And she was in a cinder block building. What you're going to see with public health in the next few years is a new emphasis and a lot of dollars put into telemedicine. We've invested in that, and in particular, trying to solve the problems in rural Georgia because we just don't have enough professionals. On my wall at the Capitol, I have a map that shows how many professionals are employed in every county in the state of Georgia. There are probably 4 counties that have no professionals. No psychologists, no psychiatrists, no counselors, no social workers, no nothing. No nothing. And that's part of our workforce development of how do you take care of people when you don't have professionals to take care of them. And one of the answers is telemedicine. And you're going to see a huge change in that with mental health and physical health. The last thing, and one that Pat's really interested in, and I have worked on now for about 3 years, is rural health care and what is happening. And if you don't know, in the state of Georgia, about 8 million people live in the 18-county MRSA, the metropolitan area of Georgia, and then another 2 million people live in the hinterlands, which is South Georgia and up here where we are in Union and Rabun and Towns County. And there's a huge health care disparity. And you may say, well, that's not a problem. Well, it is a problem. Atlanta is the economic engine, but it's our fiduciary responsibility to take care of those other 2 million people. So in the last 3 years, I have spent so much time in South Georgia. I have been to Folkestone, Georgia 3 times. If you don't know where Folkestone is, it's right down on the Okefenokee Swamp. And they had a hospital close. And what is happening is you're seeing hospitals closing all over the state, just like the banks did during the recession, that consolidation. You're seeing across the United States where insurance companies are consolidating. There's 5 major insurance carriers in the state of Georgia, and you're seeing that and the nation, and you're seeing that go down to 3. There's only going to be 3. And right now, with hospitals in the state, yes, there were a lot of rural county hospitals. I worked in those rural county hospitals. Russell and I were talking about Morgan County. I used to moonlight and go to Morgan County. It was a 10-bed hospital, but I was in school at Athens, and I was glad to go down there and make some extra money, you know. But you're going to continue to see a consolidation of hospitals. And what we have developed and what I thought about when I was traveling the state was a hub and spoke system. And you're going to go to a regionalization because every county, because of reimbursement rates, CPT codes, and ICD-10, and all these things that are occurring with the Affordable Care Act, they can't make it. And they're not going to make it. And the state's not going to bail them out because we can't afford to bail them out. We would be dumping millions, hundreds of millions of dollars into that infrastructure, and we can't. We got to educate kids first. That's our number one responsibility, is the primary, elementary, middle school, and high school, and the university system. We just can't do it. So we're developing that hub and spoke system where you have a regional hospital, and you may have 10 counties surrounding it, and it's a referral. And me being an old emergency room nurse, I told him, I said, you know, you can't have the meat wagon anymore. You just can't have the meat wagon where you throw the people in the back of the meat wagon, you get them there just as quick as you can. You can't have that. If you're going to have a regionalized system, you have to have a very sophisticated EMS system so that when you're in those outer reaches of the 10 area, and you can even do this in the urbanized Atlanta area. If you're in Barrow County and you've got to get to Grady, you've got to have a very sophisticated rolling emergency room in the ambulance system. So it's not the meat wagon where you just get them there as fast as you can and hope they don't die. You get them in the back of the ambulance and you take care of them. You have control back to the regional hospital telling you what to do and how to do it and to get them, you know, their services if they're having a stroke. Make sure they get the TPA, that they don't exacerbate and get worse. But that's part of it. So you combine the telemedicine, you combine the emergency room service, and you look at that regionalization with a hub and spoke system. And when you have the regionalization, you know, the 3 or 4 or 5 major urbanized hospital systems, whether it's Grady, it's Northeast Georgia and Gainesville, it's Columbus, it's Savannah, and it's Macon. Those are the big level 1 and level 2 hospital systems that will get these referrals. So it's real exciting times. I know that y'all are crucial because you're in long-term care, and that is very important to you. One of the bills that I wrote you might be interested in was to be able to stay in the facility and die in the facility that you're in. I wrote that law because I thought it was very compassionate. If you're in assisted living, you want to stay in assisted living, you want to die in assisted living, you don't have to go on further to the nursing home. You can die in place. And I thought that was a very important bill. Or if you're in the nursing home, you can die in the nursing home. You don't have to go to the hospital to die. So last thing I want to talk about, then I'm going to take questions, and I know Pat wants me to get down. I want to talk about your ability to lobby. You are very important. And I can't do it alone, and Sharon Cooper can't do it alone. There's over 100,000 nurses registered with the Secretary of State. I think there's about 125,000 registered nurses. They're not all working. You know, they keep their license. They may not be working. But I want you to compare nursing to teachers. Teachers are some of the most strongest advocates in the state. In an election year, and in a governor's election, and Russell can tell you, he's been there, feet on the ground, he knows this. Teachers say they want something, they want a pay raise, they want lower classroom size, it doesn't matter what they want, they get it. And the reason they get it is because they're organized, their grassroots are organized. Nurses, I hate to tell you, like I said a while ago, if you're not at the table, you get eaten on the table. You have been eaten on the table. There are many issues where you could be very, very, very powerful, but you're not. And the reason you're not is because nurses typically are doing what they're supposed to do. They're going to hospice, they're taking care of dying people. They're going to the emergency room, they're taking care of car accidents. They work their 8, 9, 10, 12-hour shift. They're dead tired. They got to go home and take care of a family. And what happens, they don't put an emphasis on laws and policy and politics. They typically don't like politics. And I can tell you, I've been there. I know politics. It's dirty. It's nasty. It's awful. But if you don't participate, you get taken advantage of. And I gave Pat a great example last night. For 3 years, 3 solid years, advanced practice nurse practitioners have tried in earnest, have tried their best to be able to expand their scope of practice and to be able to order tests, to be able to order an MRI. This is very important to y'all, especially in the nursing homes. If you need that test, you need it. Well, why should you wait on a doctor a week later to order the cockamamie test? Well, for 3 years, they've been defeated. For 3 years. It's coming back up for the 4th year. And it's only because, and they have a lobbyist, and they pay that lobbyist, but the general population, their membership is not active. What you have to do, I meet at the Chick-fil-A in Buford, Georgia, with my constituents. How many nurses has ever called me and said, Renee, meet me somewhere? And I say, okay, I'll meet you at Chick-fil-A. None. I've never had a nurse call me and ask me. Never. Now, have I had doctors? Oh, yeah. They'll meet me at the hospital. They'll meet me on the side of Interstate 85 just to get to talk to me. But the message I'm trying to get, know your representative, know your senator. Don't be afraid of them. Write them emails. What does it take? You got a cell phone, write them an email. Tell them what you don't like and what you do like. Meet them in the interim, not when they're in session, January, February, March, and April, when they can't even think. When they've moved to Atlanta, they're so busy, they have all these bills going on. So write them a letter, call them up on the telephone, tell them what you think. Call their secretary at the Capitol. Do anything, but what I'm trying to do is to encourage you. I'm not trying to be pessimistic. I'm not trying to make you feel bad. I just need your help. And the only way you're going to advance your profession with all these critical issues with the Affordable Care Act, as we advance from a single-payer system, a fee-for-service, to the single-payer system, which is going to be the U.S. government, as we advance, like I said, if you aren't at the table, it ain't going to happen. So I'm just encouraging you to get involved and to stay involved, and especially the young nurses. I meet, and I'll be going to Carrollton to meet with every dean of every school, nursing school in the state. And the deans have done a great job of integrating into their curriculum politics and lobbying and the effect on your profession if you don't do it. And what I've seen happen is they're indoctrinating them when they're in nursing school, and they do it when they're young. And then the first year, you know, they get the first job and they slide a little bit. Second year, by third year, I never hear from them. I don't know them. And that's a problem. They need to keep it throughout their career. And even if they get pregnant, you know, you take a break from your career, you know, still stay involved in politics. Politics is very, very important.
Thank you so much for your time and being up here. It means a lot. Thank you. Thank you
so
again.
much.